Hey guys, I recently just had spinal surgery and I just wanted to share some of the prep and hopefully give you some helpful tips if you are about to have spinal surgery. I had it done on my lower back. I had a slip disc, and then on Mother's Day, the disc, part of the disc actually ended up breaking in my back, which was the worst pain I've ever felt in my life. So yeah, it wasn't fun. I had the surgery 2 weeks ago on June 30th, and it's been 2 weeks, and I feel absolutely amazing already. The first 3 days were really hard, and I couldn't lay flat on my back as of yet. So I slept in the living room in a recliner, and that helped a lot because it was next to the bathroom as well. I also had someone stay with me while I was sleeping to help me get up and, just to help get anything that you may need. So it's always helpful to have someone there. So some of the prep that I did was I got a bunch of cotton dresses. I'm in one right now. And my closet, they're all hung with all of these cotton dresses. And, some are to sleep in, some are to go out with. Well, not go out with, some to make you kind of feel a lot better because 2 weeks after my surgery was my birthday. So I just wanted some nice stuff to just make you feel nice. But wearing pants was difficult. Having shorts on is hard. So you don't want really anything kind of touching that bandage area, anything that may irritate it. I also had a back brace, and I was wearing it, consistently throughout the day. Once you're not laying down or sleeping, you need to make sure that you're wearing it. Or if your doctor, like he told me today, I should stop wearing it because my incision was irritated because I was allergic to the tape that they used, the liquid tape that they used on my incision area. Only if they tell you not to use it, don't use it. But other than that, you should. Another tip was that my top drawer, I kind of reorganized it to have my undergarments and other loose big shirts or more sleeping pajamas that aren't restricting to wear at home. You will need someone to help you, take a bath and wash your hair. I still can't take like a full shower, but you'll need someone to help you like get a sponge bath or whatever it is you may need. So something else that I bought from Amazon, which was really helpful. This is a sponged seated chair. It is on top of a stool. I had that on the recliner when I was sleeping and sitting. It helps a lot with like your back posture, keeping your spine straight. It's something that I Googled to use on my bed, and it's actually been super, super helpful throughout this whole thing. Something else that I had ordered from Amazon, this was years ago, is this wedge. And as you can see, you would put your feet up this way so your legs stay nice and elevated while you are sleeping or sitting or just relaxing. It's very important to keep the pressure off of your lower back and to make sure that you aren't compromising that incision area in any way. I also had a baggie with my pills, some lip gloss, and a hair tie. Just any necessities that you needed to keep near you. And my glasses were in that baggie and my glasses case next to me. And I always had water bottles next to me. And I think that's pretty much it. I didn't go home with a walker. I made sure I was able to walk on my own or with someone, just so that I wouldn't take a walker home. I already have a cane and crutches and all of that stuff at home. I just didn't want to bring home a walker from the hospital. Now that it's been 2 weeks, I can sleep in my bed tonight. I just got cleared. I came from the doctor from my follow-up, and I'm good. The only other thing is I may have questions for you guys. I am now cleared to start doing mild workouts, and I have an elliptical. He said I can use the stationary bike and the elliptical is fine. I can do that for 20 minutes. I looked up other workouts that I can do after having spinal surgery, and some things are just a little too bizarre for me. It said that I can do squats and lunges and jumping jacks and things that I don't think anyone should be doing right after spinal surgery. Do you guys have any tips, or have you had spinal surgery, and is there anything that you recommend or suggest? Something else that I did leave out is going to the bathroom was really painful. So having things that wouldn't make you go number two, I know this is very TMI, but would be a lot helpful, because you can't put any pressure on your lower back. So that was very uncomfortable, and it was also very difficult to do. But yeah, so leave me any tips or workout tips, anything that you suggest, anything that can help someone else. I hope this helps someone. And if you are going to get surgery, do it. I feel so much better. I feel about 90% better after having the surgery, and it's only been 2 weeks, and I'm slowly moving around. I'm not that fast, but if you're thinking about it, go do it. I've been suffering with this for 11 years, and I wish I've done this sooner. But if you did have it and you have other tips that can help myself or someone else who is going to get spinal surgery or is recovering from spinal surgery, please leave a comment. All right, take care, be well, be healthy.